Good evening. Thank you all for being here. A few hours ago, Maryland's State Public Health Laboratory confirmed the first positive cases of coronavirus in Maryland. Here's what we know right now. The three patients are residents of Montgomery County. They include a married couple in their 70s and another individual in their 50s. In all three of these cases, the virus was contracted during overseas travel. The Maryland Department of Health has notified all three patients of their test results. They are currently cooperating and they're in good condition. They're in quarantine and a thorough investigation is underway to fully determine any of their potential recent interactions with the public. We have notified Vice President Pence along with the CDC. We notified Montgomery County Executive Mark Elrick, Montgomery County Department of Health, and the Superintendent of Montgomery County Public Schools, and we notified House Speaker Adrian Jones and Senate President Bill Ferguson. And while this news is serious, I want to again remind everyone that this is exactly what our state has been actively and aggressively been preparing for many weeks now in order to further mobilize all state resources in response to this threat to public health. I have issued a proclamation declaring a state of emergency in Maryland. With this declaration, I am officially authorizing and directing the Maryland Department of Health and the Emergency Management Agency to ramp up coordination among all state and local agencies and to enable them to fast-track coordination with our state and local health departments and emergency management teams. Earlier today, we submitted our supplemental budget, which included $10 million for emergency coronavirus preparedness expenses. We also submitted emergency legislation to allow us to transfer any necessary resources from the state's rainy day fund for further costs associated with the state's emergency coronavirus response. Given the rapidly evolving nature of this threat to public health, it is critical that we have the flexibility to immediately access these resources. And I want to thank Speaker Jones and President Ferguson, for their cooperation, and we're very encouraged that this legislation seems to have strong bipartisan support, and our expectation is that the legislature will move quickly on this emergency legislation and get it back to us so that we can enact it and sign it into law. At my direction, the Maryland Department of Health has worked with the Maryland Institute for Emergency Medical Services Systems to coordinate surge planning. Health is coordinating with nursing homes and assisted living facilities on infection control protocols. The Maryland Emergency Management Agency has elevated the state response activation level and fully activated the State Emergency Operations Center to further support resource requests from around the state. The Maryland Department of Education has issued guidance to local school systems regarding their authority to determine school closures if necessary. The Maryland Higher Education Commission is coordinating with the University System of Maryland and other institutions, coordinating with them on bringing students home from study abroad programs and potentially canceling other travel overseas. And all state agencies have reviewed and updated their continuity of operations plans. Our administration's highest priority is keeping our residents safe, and all of the actions that we're taking will allow all levels of government to better collaborate and to respond to this threat in a coordinated and effective manner. While today's news may seem overwhelming, this is not a reason to panic. Marylanders should go to work or go to school just as they normally do. At the same time, I want to continue to remind everyone to prepare themselves and to continue to stay informed. As the CDC warned last week, local schools and daycares should be prepared with contingency plans for potential long-term closures. Local communities and cities should be prepared to modify or postpone or cancel mass gatherings, and local businesses should be ready for office closures that require their employees to work from home. And these are the kinds of things that people should continue to plan for. And we will continue to track this rapidly evolving situation, and we will be receiving almost constant, up-to-the-minute information. The public should be assured that our state's preparedness builds on decades of planning, experience, and expertise gained from previous and ongoing public health events. And we're very fortunate that Maryland has some of the top health research facilities in the world. And I'm confident in our state's ability to respond effectively to these cases of coronavirus, as well as any future cases, and also to be a national leader in responding to this situation and potentially in developing treatments and perhaps even a vaccine. We will continue to update our citizens as the situation develops. All of the latest information can be found by visiting health.maryland.gov/coronavirus. Residents can also dial 211 to connect with a helpline representative to get information and community resources for the coronavirus. Now, at this time, I'm going to turn it over to the Deputy Secretary for Public Health Services, Fran Phillips, who will provide you with some further details. Fran?
Thank you, Governor. Just to echo the Governor's remarks, this development today, the confirmation of 3 positive cases of the coronavirus here in Maryland, is not an unexpected event. We have been preparing for this event with many, many partners across the state. We have been watching very closely, and as it happens, these 3 individuals had specimens that were run in our lab, and so you know that our Maryland Public Health Lab here in Baltimore was brought up into operation earlier this week. And so these are individuals that, as the Governor said, had an exposure in the course of international travel, returned home to Maryland, and when they were notified that they had a possibility of exposure, they were brought to a hospital. Actually, they brought themselves to a hospital because they are not severely ill. They were not hospitalized. They stayed at home and brought themselves to a hospital in order to be tested, in order to have those specimens collected and sent to the Baltimore lab. The results came out this afternoon, and what is happening right now is a very, very thorough investigation using public health resources in consultation with the federal government, the CDC, with the state of Maryland, as well as with Montgomery County Health Department. And this is very important because we want to understand all of the activity, all of the comings and goings of these 3 individuals who are at home, they have remained at home, and they've been extraordinarily cooperative. We want to understand during the period of time when they returned from travel and when they had symptoms, flu-like symptoms, we want to understand exactly where they went, who they interacted with, in order that we can conduct this investigation. We have tremendous support, as I said, from the CDC as well as from Montgomery County. A very specialized team of disease investigators are working in Montgomery County with these individuals. And we will expect to have more details tomorrow as the investigation progresses. I'm pleased to say that these individuals are very cooperative. Their symptoms are abating. It is a couple, a man and a woman, and another person who is unrelated. So they live in two different households. They are, as I said, cooperative. They are in isolation now. They are not leaving their homes, and we are in very frequent contact with them. I will stop at this point and be happy to answer any questions that you may have.